Hello, and thank you for joining Immunize Canada for the webinar on storage and handling of immunizing agents. I would like to take this opportunity to thank the Public Health Agency of Canada for providing the funding to make this webinar possible, one that we hope you will all enjoy. I would now like to introduce our speaker today, Dr. Susan Bowles. Dr. Bowles is an Associate Professor of Medicine and Pharmacy at Dalhousie University in Halifax, Nova Scotia. She also serves as Clinical Pharmacy Specialist in Geriatrics at the Centre for Healthcare of the Elderly, Capital District Health Authority. Dr. Bowles works closely with public health services in Nova Scotia, particularly around the prevention and management of influenza in the long-term care setting. In addition, she works with Pharmacy Association of Nova Scotia and the Canadian Pharmacists Association to enhance the awareness and promotion of adult immunization through community pharmacies. Dr. Bowles was appointed Vice Chair of Immunize Canada in 2007, and in November 2011, she was appointed Chair of Immunize Canada. Welcome, Dr. Bowles.
Thank you. So I'm going to start off with my disclosures. So I've had grants and research support from the Dalhousie Pharmacy Endowment Fund with regards to immunization-related research, and I do receive speaking honoraria for the Dalhousie Continuing Pharmacy Education Program, largely around our education program for pharmacists as immunizers, and I have no consulting fees to disclose. So today I have three objectives that I want to cover within this presentation. The first is that people gain an understanding of the importance of the cold chain. Secondly, that they will be able to integrate national storage and handling guidelines into practice, keeping in mind that there are new national guidelines in progress, so some things may change, and also keeping in mind that these national guidelines have been adapted by a number of different jurisdictions, so it's best to be in touch with your provincial public health group and use the jurisdictional guidelines that are in place for in your area. And thirdly, want to discuss about how to respond appropriately to cold chain incidents. So first is a definition of what the cold chain is. So it's maintenance of optimal conditions during the transport, storage, and handling of vaccines that begins at the manufacturer and ends with the administration of the vaccine. So that's something to keep in mind. And why is the cold chain important? It's important to remember that vaccines are damaged by exposure to excessive cold, heat, and/or light. And if vaccines are damaged by these exposures, we may be administering a product that is less than optimally effective or potentially ineffective. And if we are using an ineffective or less than optimally effective product, that increases the risk of vaccine-preventable disease occurring even following vaccine administration. It's important to keep in mind that the loss of potency is cumulative, so repeated exposures to cold chain breaches are particularly problematic. And it's also important to keep in mind that vaccines have an expiry date, and so the expiry date needs to be carefully looked at when administering a vaccine. Public confidence in vaccines can be problematic. Certainly we're fighting something of an uphill battle with the anti-vaccine group, and if we have to revaccinate people who've received a potentially ineffective vaccine, this can further erode public confidence in immunization programs. And finally, the cold chain is important from a resource management perspective. If we have to quarantine vaccine and can't administer it, that affects the supply chain of vaccine and can result in cancellation of clinics, and also contributes to wastage and increased expense for vaccine programs. So in terms of how big a problem are cold chain breaches, it's estimated that 17 to 37% of healthcare professionals expose vaccines to improper storage temperatures. The refrigerators can be too cold, or there can be direct exposure to ice packs during transport of vaccines, and this can result in fridge-stable vaccines freezing. Or refrigerators can be too warm, or there can be a problem during transport where vaccines are transported in conditions that are outside of that of the guidelines for fridge-stable vaccines of 2 to 8 degrees Celsius, or frozen vaccines can also be transported inappropriately. So storage conditions for vaccines, for fridge-stable vaccines, which is the majority of vaccines, the guidelines state that they should be maintained within a temperature range of 2 to 8 degrees Celsius, and you want to aim for the middle of that temperature range at 5 degrees Celsius. Vaccines that should be kept frozen, such as the herpes zoster vaccine, these should be maintained at a temperature of less than or equal to 15 degrees Celsius. You also need to keep in mind that some vaccines are light sensitive, so they need to be kept in original packaging. And you also need to be familiar with specific storage conditions for diluents. So diluents are often not stored under the same conditions as their corresponding vaccines. So you need to make sure that they are also stored properly and in an organized fashion so that it minimizes any risk of error where the wrong diluent might be used with a vaccine, which can also be problematic. This is some data from the BC Centre for Disease Control for 2009, and these were common reasons for cold chain breaks. So this occurred, power interruption, equipment problems, and handling errors are the most common reasons for cold chain breaks, and so that's something to keep in mind when planning your protocols for the cold chain. So what makes for an effective cold chain? The first is people, and so people will need proper training. The second is equipment, and that's equipment not only for storage within a facility but also for transportation from manufacturer to the facility or from the facility to clinic settings and during a clinic setting. And you also need policies, procedures, and protocols that take care of the everyday workings of an immunization practice, but also for those unusual things that can occur. So you need what to do if something like a power interruption happens. So those all need to be in place so that people who are properly trained know exactly what to do. So when it comes to people, this is anyone who handles and or administers vaccines. So they should all have an understanding of the importance of the cold chain. They need to use best practices. They need to be very familiar with policies and procedures as well as urgent protocols. And every person who handles or administers vaccines should understand their responsibility to the cold chain. Equipment, you need a refrigerator. You can have a purpose-built refrigerator, which is shown in this diagram here. These you may see in hospitals or in provincial depots for vaccine, etc. Smaller vaccine practices, you can use a domestic refrigerator. It's important, however, that you know your refrigerator. You need to understand where the temperature zones are in the refrigerator so that you store vaccines in certain areas only. For example, you're not going to keep it in the door of the refrigerator, and you're not going to keep it close to the air vents because that can result in fridge-stable vaccine freezing. You also need to have an understanding of how the ambient temperature impacts the internal temperature of the refrigerator, and this is the reason why we have temperature monitoring, and we'll talk about that in more detail in a minute. You also don't want any commercial or domestic bar fridges. Those will not meet the requirements for an appropriate cold chain. When you're organizing the refrigerator, you want to, for the refrigerator itself, you want to remove the deli and vegetable, fruit, crisper drawers. You want to store only vaccine in the refrigerator. You want to check and log the temperature twice a day, and we'll talk about that in more detail. You only open the door when it's necessary, so the more times the door is opened during the day, this can affect the internal temperature of the vaccine, and it's more likely for the temperature to go out of range. Again, for fridge-stable vaccines, you want to keep the temperature between 2 to 8 degrees Celsius with a name of the mid-range at 5. Again, because the doors are the warmest area of the refrigerator, you don't want to store any vaccine on the door shelves. You will see that this picture has full water bottles on the empty shelves and in the door, and this helps keep the temperature cool within the refrigerator, particularly if there is a short power outage. You want to stock your vaccine on a first in is the first use basis, so you want to make sure that those are kept to the front and rotated appropriately as you receive new vaccine deliveries. And you want to have approximately a 1-month supply of vaccine, so that you're not, for example, if you have a significant cold chain breach and the vaccine needs to be quarantined and/or disposed, and then subsequently disposed of, you haven't had loss of an entire season's worth of influenza vaccine, for example. And again, the thermometer placement should be on the middle shelf in the refrigerator, which is where you are going to want to store your vaccine. For a domestic fridge that has a freezer component, you put your frozen packs in the freezer. And again, that can help maintain the temperature of the freezer in the event of a short power outage. And the thermometer should be in the mid-compartment and not on the freezer floor. So in terms of thermometers, there's several different types that are available. There's data loggers, which are really ideal because they provide real-time continuous monitoring. And they are, you will see these in purpose-built refrigerators. There can be strip monitors, which are sometimes used for transport. There's chart monitors. There's min-max thermometers. And there's digital thermometers, some of which have that min-max feature. What you are not appropriate are household mercury type thermometers. These bimetal stem thermometers, which look like a meat thermometer, or a fluid-filled biosafe thermometer, sometimes known as a bottle thermometer. In terms of protocols for temperature monitoring, the temperature should be monitored at least twice daily. And during this process, the current temperature should be monitored. And again, with those min-max temperatures, you will have a minimum and maximum refrigerator temperature. If it's out of range, you assume the thermometer is correct, and you want, most importantly, you want to protect the vaccine if the temperature is out of range. And if this does occur, you contact your local public health unit and/or the vaccine manufacturer if the exposure is outside the recommended range. This is just an example of a temperature monitoring form that can be used. This is from courtesy of the BC Centre for Disease Control, but every local public health unit will have a temperature monitoring form and you can develop one based on what the requirements of your public health units. Now, in terms of policies, procedures, and protocols, you again need those for routine storage and handling, which includes temperature monitoring. You need them for shipping vaccine between sites, for protecting the vaccine during clinics, and also for those unexpected things such as urgent and that would require urgent and emergency storage and handling. So for routine storage and handling, staff education is key in all areas, but you will need one lead person and at least one, if not more, backup people for those individuals who are, when they're on vacation or off sick. And you want to limit your access to vaccine for any untrained personnel. Immediately upon receipt of vaccine, the person who receives the vaccine should be educated to place vaccine in the designated refrigerator or freezer for frozen vaccine immediately upon receiving it. It's important to post the storage and handling guidelines prominently so that people can refer to it, particularly those backup people who are perhaps not as familiar because they don't do it every day as your lead person. The stock needs to be rotated accordingly to expiry date, first in, first out. Separate products with similar packaging should be clearly marked and separated. You can use trays for this, for example, to minimize the risk of an error where the wrong vaccine is administered. And you again need to have alternate storage in the event of a cold chain break. There also needs to be protocols for temperature monitoring. Again, that should occur at least twice a day if you don't have a continuous temperature monitor. There needs to be protocols for equipment maintenance and repair, as well as vaccine storage, response to storage and handling issues, receiving, packaging, and transporting the vaccine, inventory management, and disposal of vaccine. So for vaccine transport, it's important to keep in mind that there are summer and winter configurations. Here in Nova Scotia, our summer configuration applies early April to mid-November, and our winter configuration would apply mid-November to the end of March. However, there will be different dates in different jurisdictions, so you should check with your local public health office for the dates that are applicable to your jurisdiction. Because of time, I'm not going to show you examples for both the summer and winter configuration, but this is an example of summer configuration that's recommended in our Nova Scotia Immunization Manual. And again, you should check with your local public health office because this may be different in different jurisdictions. It's important to keep in mind that you remember the temperature monitor when packing a cooler for transport. We condition the cooler with at least 5 to 30 minutes prior to packing the cooler. Wrap the vaccine in fan-folded, refrigerated, insulated blankets, and you can see that we placed refrigerated gel on the bottom, and the vaccine is protected from the frozen gel pack so that it does not freeze. This slide is just to remind you that if you are transporting vaccine between sites, that it should not be stored in the trunk but in the back seat of a private car. Now, protecting the cold chain in the clinic setting, again, you want to ensure the potency of the vaccine, so you want to minimize the number of times the cooler is open during the clinic. You want to record the temperature before you leave the office, upon arrival at the clinic, but before you begin immunizing. every 3 hours or so during the clinic. And again, the protocol for this may be different in different jurisdictions, so check with your local public health office. You want to record the temperature following completion of the clinic, but before you transport the vaccine back to its storage site. And then you want to, again, check the temperature upon return to the office before you restore the vaccine. Now, urgent and emergency situations do occur. This is my neighborhood during Hurricane Juan in 2003, and this is a picture of the ice storm in Toronto this past December. So with weather events, we do get some pre-warning about these, so we can think ahead and consider predictable power disruptions, and then we can have protocols in place to move vaccine, for example, to another area. You want to have people identified who are going to be responsible. You need to have staff availability sorted out, and you need to have important telephone numbers, the power company, for example, what is the estimated time of the power outage. Have an alternate storage facility, so for example, during Hurricane Juan, the vaccine went to hospitals that were powered by generator. And you need to have contacts from the manufacturers. You need to have alternate storage set up. That alternate storage has to have appropriate monitoring, and again, you need to have agreements with those facilities. So if there is an emergent situation, such as a flood, a prolonged power outage, that other facility is prepared to take the vaccine. And then you need to think about how you're going to get it there. So what are the transportation considerations? And then which vaccines are you going to move to that alternate storage site if it's impossible to transport it all? So you probably are going to want to transport the most expensive vaccine. When you have a cold chain break, it's important, first of all, to contact your local public health unit and to complete a cold chain incident report. When you identify the cold chain, you want to cold chain break, you want to quarantine any affected vaccine under proper storage conditions, and you don't want to use that vaccine until it's been determined as to whether or not it can be used. So public health will give you guidelines about whether the vaccine is still usable, and if it is yes, you want to remove it from quarantine. Label it as exposed with the date that it was exposed. It needs to be used, and it needs to be used first. If you have multi-dose vials that have already been opened, for example, influenza vaccine multi-dose vials, then you would not be using those in the event of a cold chain breach. If the vaccine is deemed not usable, it should be disposed of as per protocol, and for publicly funded vaccine, this usually involves it being returned back to the public health. If you suspect the vaccine has been frozen, and freezing is an important problem, and in fact, most of the time, vaccines that cannot be used is because it has been frozen. So this occurs because it's been too close to the freezing compartment in the fridge or too close to the ice packs and insulated coolers. And again, fridge-stable vaccine cannot be used if it has been frozen, and a diluent should not be used if it has been frozen. There's in the current guidelines, the shake test is not recommended to test for freezing. However, the World Health Organization has validated the shake test, and so there may be some change when the new guidelines are available. Now, I'm not going to go into detail about how to do the shake test, but I have a link to a video that provides very good instructions on how to do that. So thank you, everyone. I just want to simply go through a review of the objectives. So we've defined and outlined the importance of the cold chain. We've reviewed the National Storage and Handling Guidelines, again keeping in mind that 2014 national guidelines are in progress, so there may be some things that change. So when they are made available, please take a close look at them. And also keep in mind that the national guidelines have been adapted by different jurisdictions, so it's important to follow the guidelines that your specific jurisdiction uses. And we've reviewed the response to cold chain incidents. Thank you.
Great, thank you, Susan, and thank you everyone for joining Immunize Canada for the webinar.